We'll now hear from our 5 finalists. So join me in welcoming our first presenter, Choice Home Healthcare, Inc. from Bettendorf, Iowa. Let's give a round of applause.
All right, good afternoon. It's great to be in Iowa City and presenting. I feel like we've got a unique opportunity here with Choice Home Healthcare that both helps grow our business and also helps the community. So we're excited to present that to you today. Choice Home Healthcare is a home health care agency based in the Quad Cities. Our region is really the entire Quad Cities and the surrounding region of the Quad Cities. There are 471,000 people in the Quad Cities and the surrounding region. So we service both Iowa and Illinois. We actually just received our Illinois license, and so we're able to operate in Illinois now, which is very exciting for us at Choice. Just got that the other day. So we'll be serving both sides of the river in the Quad Cities, both Iowa and Illinois patients. We're a for-profit home health care agency. One thing that's unique about us is that we're locally owned. Our investors are all in the Quad Cities or from the Quad Cities, and we're locally owned. We're not a franchise. And that's, if you go look at other home health care agencies, there's a lot of franchises out there. Not that there's anything wrong with that, but I think it's a little more personal touch when you've got local investors that are involved in it. The median age of the Quad Cities is 40.5 years. As we start to talk about home health care, it's a very growing industry. Baby boomers are getting older. They're aging. They want home health care. They want to stay in their homes, and so we're going to talk a little bit about that and how our program can help that. In the area, there are 35 other home health care agencies in the Quad Cities. And as I said, many of them are franchises. The majority of them offer non-skilled type care. We offer both skilled and non-skilled. Skilled encompasses the actual medical care of a patient inside the home. Non-skilled care is giving baths, taking care of the home, really just being there as a companion in some cases. So we perform both types of care there. Our largest competitors are the 2 hospital systems, Trinity or Unity Point and Genesis. And they both do a lot of home care, a lot of Medicare home care. It's probably impossible for us to compete directly with the hospitals. They're always going to be the largest, but there's a lot of patients that need us and a lot of patients that don't. They go into the hospital and they spend time in the hospital. The last thing that they want to do is come home and have to have hospital care and have Genesis or Trinity in there. So we feel like that adds to the personal touch. Nationally, there are 330,000 home health care agencies across the country. It's $74.8 billion in total revenue, so you can see it's a really large business now, projected to grow over the next 10 to 15 years. That is 5.5, that translates into $5.5 billion in total profit nationally. So, and the annual growth rate that you're seeing with home health care is about 3.6% per year, so revenue is growing about 3.6% per year. According to Harrison Williams Company, home health is poised for continued growth as the population of people over 65 years old is expected to expand by over 40% by 2020. So think about that. That's a huge number of people that are going to be expanding into the retirement years and needing care. One thing that's really great about home health care, this is separate from our business, but home health care in general, is that you get to stay in your home. And it's proven that if people can stay in their homes, they'll be more healthy, they'll live longer, they'll have better lives. And so you're seeing that more and more from people. They don't want to go into assisted living. There's a higher risk of accidents in assisted living. There's a higher risk of getting sick. People want to stay at home. And so that's what we're really focused on. That's the kind of things that we try to do. I talked about that we're locally owned. Our owners and our senior management have over 50 years of healthcare experience. So we come from different industries, different things, but we have a lot of experience in healthcare, and I think that's important because we can tie in different kinds of healthcare together. So we've worked in clinics, we've worked in hospitals, we understand how the whole system works. And I think anybody who's gone to the doctor knows that the healthcare system is kind of confusing and can be really confusing for people trying to navigate through that. One of the program we're talking about, the things that we want to really do, these are our types of care, and we talked about that. The one I want to focus on is Alzheimer's and dementia care. The program we're talking about today and how we would use the funds is called Music and Memory. The money would allow us to buy iPods, market the program, and really offer that to a program to people that don't have that in their homes. Alzheimer's is the 6th leading cause of death in the United States. It is the only disease in the top 10 that doesn't have any way to cure it or slow it down. So once you get it, it's kind of a death sentence, and it's a miserable way to live. As you go through, as the program we're talking about, music and memory, it gives people a chance to remember things. They really come alive. So you buy iPods, you put music in, and people remember things. They remember moments in their lives. They tie their moments to those songs. So it's very exciting. It's what we would like to offer and what we'll use our funds for. As I said, we'll buy iPods, headphones, and we're partnering with the Alzheimer's Association of Quad City. Revenue from this, Alzheimer's patients need a lot of additional care. So while the program we would offer would be sort of a free program, they need other care. They need both skilled and non-skilled care services. We estimate that we would generate about $120,000 annually in revenue from this program, and that we get 5 new patient referrals per month. That would allow us to create 30 new caregiver jobs, and allow a program that isn't being offered in the Quad Cities anywhere, allow us to offer that program. It's a unique opportunity for us. We're very excited about it, and we hope you see fit to fund us for this program. Thank you for your time, and thanks for letting me present.